Hello, my name is Cheyenne. I'm going to be doing a Foley catheter insertion, care and removal. So we are going to start by identifying our patient orders, verifying them, and gathering our equipment. I've already gathered my equipment right here, and these are going to be my patient. But I'm going to do the male, but I'll just kind of go over this one really quickly too while I'm doing it. So we are going to first go into our room and identify our patient by two patient identifiers, asking name, date of birth, checking with their wristband, and then I'm going to verify their allergies, make sure they're not allergic to iodine. And then I'm going to wash my hands, and I'm going to don clean gloves, and I'm going to do peri-care as needed. And sometimes we use the clean wipes, and you would just, I have my gloves on in this scenario, and it would come with 3 wipes, and you would just wipe, discard, wipe, discard, wipe, discard. And with the female, you would wipe farthest away, discard, wipe towards you, discard, and wipe down the middle and discard. You also want to make sure that no incontinent urine or feces is there to disrupt your sterile field. And then you're going to remove the gloves from doing that perineal care and wash your hands. So we're going to set up our space. So this is going to act as our patient, and we're going to provide comfort and privacy for the patient, and then we're going to explain what we're doing, and then we're going to get started. So we're going to remove this. I'm going to take a little bag. And yes, we're going to start with the corner farthest away, and there's going to be this drape. So I'm going to open this drape up with the 1-inch margins, and a shiny side is going to go down. Okay. And then in reality, this would be in a different spot. This would be with the patient in the bed, and this would be on its own table. But for checkoff purposes, we're just going to pretend that these are in 2 separate places. All right, we're going to open the 2 side openings. I'm going to bring this in a little closer so you can see what I'm doing. 2 sides, and we have our sterile gloves right here. So open these up. And apply these sterile gloves. All right, we're going to start with our dominant hand. And then we're going to do this one. Keep thumb out. And then we're just kind of gonna, all right. And then we're gonna continue. All right, so now this is our sterile field. Okay, so now I'm going to take this drape, and we're going to drape it over the penis. This is our alcohol swabs or iodine swabs. I'm not going to open these, so for the sake of just being easier, we're going to have these cotton swabs represent these. So in reality, I would open this up, put these in here, pour the solution over them and then discard this. Then we have our lubrication. I would pour it in here in this little slot, and then I would discard it. And then I'm going to, this is still sterile, so I'm going to place this right here. And then I'm going to take this syringe and I'm going to just place it on the catheter. I'm not going to flush or anything. And then we're going to move the catheter out. Careful holding so that it doesn't break sterile field, and discard. And then we're just going to pick this up and drape it in here. My kit does not come with a leg securing strap, so I would have had to grab that beforehand so that I would have it, or have another nurse or help assistive personnel grab one for me for when this is finished. So I'm going to take this and I'm going to put it in that lubricant that I had, and we're just going to place it right there. And now we're going to clean. So we're going to take our non-dominant hand and we're going to grab the penis and have it at like a 90-degree angle. This hand is now non-sterile and is going to remain here until the process is finished. We're going to take our first, what would be iodine or alcohol swab, circle around one time. So one circle around, discard. One circle around, discard. One circle around, discard. And then we're going to lubricate that catheter 2 to 3 inches. And we're going to tell the patient to take some deep breaths and bear down. And when you hear him exhale, we're just gonna start inserting 5 to 7 inches, or until we see urine flashback. And at this point, we're going to say we see urine output, and then we're going to take the syringe and we're going to inflate the balloon of the catheter with this sterile saline. Okay. And then remove. And then we can remove this. And we're going to gently tug until this balloon is sitting securely. And we're going to secure the leg strap or whichever securing device you have. And then we're going to put the catheter bag at hooked onto the bed. Do not let it touch the floor. Always below bladder level. And that is it for the catheter insertion. Making sure it's not kinked or anything like that. And then you're going to document the size, the type of catheter, how the urine looked when it was removed, and the patient's tolerance to the procedure. Now, if I was removing the catheter, let's see, let me actually do catheter care before I do removal. So for catheter care, we're going to, first of all, get rid of all this sterile, because this is no longer sterile, and this would be a whole nother procedure. So I'm just going to move all this down here. All right. So for catheter care, we would gather our equipment, and after I was done taking off those gloves, I would perform hand hygiene and put the patient back in a comfortable position. So for catheter care, we would gather our equipment. I would really just use a rag or yeah, just a rag with soap and water. I'm going to gather my equipment, so some rags, some soap and water, maybe a basin, and I'm going to identify my patient with 2 patient identifiers, and then I'm going to explain what I'm doing, provide the patient comfort, get them in a nice position, maybe make the room warm, and then we're going to perform hand hygiene and don our clean gloves. We're going to position them in either dorsal, recumbent, or supine position. We're going to place some waterproof pads underneath so we catch any water that splashes. And we're going to remove the catheter device. If I had a leg securing device on this patient, I would remove it from that leg securing device. And with our non-dominant hand, remember I have gloves on, with our non-dominant hand, we're going to expose the penis, pull back the foreskin if need be, and wash from the tip of the penis to the base, so clean to dirty. And then we're going to take the catheter tubing near the meatus and hold it and wipe down to about 4 inches and then rinse all off. And then we're going to retract the foreskin back, dry them off. And once that's done, the catheter care is done and we can remove our gloves and perform hand hygiene. And then if we were to be removing the catheter, we would gather our supplies, which really all you need is some gloves and a 10 mil syringe and something to dispose of the catheter in. We're going to empty the catheter bag, make sure it's completely empty, and then we can remove it from the hook on the side of the bed and place it on the bed so it's just easier. We're going to identify our patient, explain what we're doing, perform hand hygiene, don our gloves, and like I said, empty the bag, put it on the bed. We're going to take an empty 10 mil syringe and we're going to place it in the same place where we entered the syringe, and we're going to pull out the 10 mil. All right, and then we can discard of that, and then we're going to tell the patient to take some deep breaths, and as they take deep breaths, we're just going to pull it out, and I would wrap this up in my gloves and dispose of it, and that would be it. And we would just watch the patient for some urine output, and if urine output has not been assessed within a couple hours, we would contact the healthcare provider for the next steps. That is my catheter insertion, care, and removal. Thank you.